Hello and welcome to this video exploring rapamycin and its potential as a longevity or anti-aging medicine. Expect to learn why rapamycin is of interest to those looking for ways to live longer and healthier lives, what rapamycin is, how it works, whether or not our current evidence supports or refutes the anti-aging hype surrounding it, how safe rapamycin is, what doses people are taking for longevity, and how you might want to go about deciding whether or not to take it. First, why do we care? Rapamycin was the first molecule tested in mammals, mice to be specific, to reliably and repeatedly extend lifespan. It has done so in over 10 studies carried out by different research groups on different mice populations. In the first study of its kind in 2009, mice given rapamycin at day 600 of life and onwards, or around 2/3 of their expected lifespan, experienced a surprisingly large boost in lifespan, outliving their placebo counterpart by 14 and 9% respectively for female and male mice. To firm up the strength of their findings, the research group conducting this study carried out the experiment across 3 different university settings with 3 sets of genetically diverse mice to reduce the likelihood that these results were an artifact of a particular genetic quirk of the mice being studied. Next, what is rapamycin, also known as sirolimus? It's a naturally occurring molecule produced by a strain of bacteria native to the soils of Easter Island, known as Streptomycin hygroscopicus. Easter Island is known as Rapa Nui in its local native language, and this name is lent to the name rapamycin. It was first collected by scientists interested in modern evidence-based medicine in 1964 on a Canadian voyage, and a Dr. Suren Segal went on to isolate from his soil sample a molecule of interest. It was noticed that it prevented growth of fungi in adjacent soils, so it was initially explored by Dr. Segal as a potential new treatment for athlete's foot, but it was found to suppress some of the componentry of our immune system, so it was ditched as a potential antifungal treatment. Still, Dr. Segal was impressed by its many actions, and in 1981 he provided a sample to the National Cancer Institute, who found rapamycin capable of reducing growth rates of several cell lines of cancer cells outside of the body, though not sufficiently capable that it was taken forward and explored as an anti-cancer treatment, and it isn't licensed for this use even today, except for treatment of a very rare tumour type called perivascular epithelioid cell tumours. Then, abruptly, in 1982, the laboratory in which Dr. Segal worked was closed down. He was ordered to pack up his stuff and destroy whatever he was working on. Promptly, he ignored this order and took his rapamycin sample home with him, as he remained convinced that it was powerful and worth further investigation. By the end of the decade, rapamycin had been approved for and was being used in mouse studies. In these, it was proven to moderate growth of certain tumours and to effectively downregulate the immune system. This immunosuppressant effect was picked up by organ transplant surgeons who had long struggled to prevent the host body's immune system from attacking and destroying the transplanted organ that they had worked so hard to get in there. And in 1999, the FDA approved its use under the brand name Rapamycin for preventing the rejection of liver and kidney transplants. The question remained, how does rapamycin work? Well, rapamycin enters the cells of our body and binds to a particular protein called mTOR, or mechanistic target of rapamycin. mTOR plays a big role in cellular growth, division and replication, something akin to the role of a production manager on a factory assembly line. If the production manager tells the machinery of the cellular industry that today is a double shift and lots of new cell parts are needed and that the cell should replicate, then that is what tends to happen. If instead mTOR, or the production manager, tells everyone to go home early because we've made enough cellular widgets already, then that is what tends to happen. When rapamycin reversibly attaches to mTOR, it has the effect of whispering in the production manager's ear and calming it down to ensure that the factory has a slow day. We also know that other factors such as an abundance of food tend to amp up mTOR and increase cellular activity and replication, and that a scarcity of food, or fasting, tends to quieten down mTOR. This slowing of cellular growth and replication seems intuitively like a good idea for slowing the rate at which our cells accumulate age-related damage, because replication cycles themselves tend to gradually accumulate more and more DNA damage, but it also suggests good reason to avoid rapamycin in those of us young enough that we are not fully grown and developed, as it may impair these processes. So that's a lot of useful information to help us better understand rapamycin and how it works, but the question we came here for remains: what's the scientific evidence that rapamycin is effective in increasing our lifespans and health spans? Well, the first thing to note is that, unfortunately, for lifespan research, we lack the ability to conduct in a timely manner randomized control trials in humans to prove the effectiveness in those we care most about, ourselves. This is because they take ages, are plenty expensive, and because aging is not classified as a disease in and of itself, it can be hard to acquire ethical approval and funding for giving out powerful drugs to treat something that's not even yet recognized as a disease. So instead of finding definitive answers to important questions with high-quality human RCTs, we find ourselves shining torchlights into murkier, darker places in the relative high-quality data desert of small mammal studies and limited lower quality studies in those small numbers of humans already taking rapamycin for longevity purposes. Let's get into it. So let's explore what evidence already exists to suggest rapamycin may be of benefit when it comes to extending lifespan and health span in humans. Well, firstly, as we've already mentioned, rapamycin has been shown to repeatedly increase longevity in mice in over 10 studies, plus it's been found to do the same in yeast, fruit flies and worms, but overall we're most interested in mice because they are the largest mammal and most similar creature to us in which we have good quality data. Studies have also found that rapamycin benefits the health span of rodents in numerous ways, including by lowering incidences of certain cancers, improving cognition as they age and preserving ovarian function. Unfortunately, we have no good studies on any larger mammals, but we will have two interesting but limited studies in human populations, the first of which was a 2023 paper published in the Journal of Geroscience, which surveyed the experiences of 333 humans taking rapamycin for longevity, and the second of which was a 2024 attempt at a systematic review of rapamycin as an anti-aging medication published in The Lancet. We'll have a look at both of those now. Let's get into those two studies. Firstly, that survey of 333 people currently taking rapamycin for longevity or anti-aging reasons. Obviously, this is not a particularly robust, high-quality study, and therefore we're not going to put too much weight into its findings, but let's see what we can learn. Firstly, the authors highlight that part of the popularity of rapamycin and metformin stems from these drugs being licensed by the FDA and used by doctors for other indications, giving us a better feel for the likely side effects and safe dosing strategies than for any new molecules developed specifically to extend lifespan. However, it fails to tell us much more that we don't already know. It goes on to briefly explain the mechanism of action and then the current indications of rapamycin, before going on to detail its own methods, which were essentially to send out questionnaires to 333 people using rapamycin to talk about how they're going on it, and to compare it to 172 non-users of rapamycin. So what do we have? Let's see. We've got a breakdown of who was included. We can see that overall it's a predominantly male phenomenon to be both taking rapamycin and responding to this study, and that people taking rapamycin tend to be around 60 years of age and with a healthy-ish BMI and weight. So they're perhaps quite body conscious already, and they're engaging in other healthy habits such as exercising regularly and having a healthy diet. And then back to the article real quick. Reported length for the users of rapamycin. We've got people taking it from less than a month in about 48 people's cases to 46 people having been on it for more than 3 years. And let's get into some of the results. So the one result displayed is how much people were taking. We can see here in figure 1 that the sorts of doses that people are currently being prescribed and taking for anti-aging reasons are typically around the 5 to 6 milligram per week mark. This does not mean that they're necessarily right, or that future historians will decree that 6 milligrams is and was the sweet spot for a long and healthy, happy life, but it does give us an idea of the consensus opinion of the doctors currently prescribing rapamycin as an anti-aging medication. The paper then goes on to detail the subjective health experiences as reported by the rapamycin users and by the cohort of people not using, and we can see that overall people feel that it's generally quite agreeable and positive for their health across a variety of important life experiences. So that's promising as well. Next we have the reported frequency of potentially negative incidences of health events, and we find that overall the rapamycin users have lower rates complained of or reported of abdominal cramps and pains, depression, anxiety, muscle tightness and eye pain, and significantly increased rates of mouth ulceration, which is a well-established side effect of rapamycin. And then there's a number of factors where there's a much smaller difference between users and non-users. The first thing to say about this study is it only found 19 studies to be included in a systematic review, and when we go down to the studies included, we find that many of them are extremely short term, being measured in study duration in a small number of days, with the maximum being 2 years down here, and that the sample sizes studied are very small, with some studies having as few as 6 people. This is significant because although systematic reviews are a high quality form of data, they're only as strong as the primary research upon which they are built, which is to say, not very much here. So, given that the study's not very strong, we're not going to spend a lot of time looking through it. We'll just cut straight to the abstract, flipping it all around, and we'll report the following. Rapamycin and its derivatives improved physiological parameters associated with aging in the immune, cardiovascular, and integumentary or skin and associated structures systems of healthy individuals or individuals with age-related diseases. Overall, no significant effects on the endocrine, muscular, or neurological systems were found, and the effects of rapamycin on numerous systems, including the respiratory, digestive, renal, and reproductive systems, were not assessed in the studies. No serious adverse events attributed to rapamycin and its derivatives were reported in healthy individuals. However, there were increased numbers of infections and increases in total cholesterol, LDL cholesterol, and triglycerides in individuals with aging-related diseases. These are not necessarily reasons to spurn rapamycin, but they might need monitoring for and treating as you go. Future studies should assess the remaining unexamined systems and test the effects of long-term exposure to rapamycin and its derivatives. So, not enough information available and not over a long enough time frame. Clear as mud? Good. Next. So, we've reviewed what little data there is, and it seems overall there is plenty of reason for cautious optimism. But the question remains, how safe is rapamycin, and what sort of risk versus reward calculations should we be computing? Well, rapamycin and its cousin everolimus both carry significant risk of unwanted, unpleasant side effects, including commonly mouth ulceration and tongue ulceration, and elevated blood lipids, including LDLs, and an increased risk of certain infections and diarrhea. Other potential side effects are acne, joint swelling and pain, and hypertension. However, rapamycin does show the promise as a potential agent that can help us slow the process of aging, which brings with it a multitude of other incipient risks well worth trying to mitigate. So, with significant blood monitoring and oversight from an experienced physician, it may well be worth your while to consider taking rapamycin based on your own age, tolerance for risk, and availability of resources. And if we are going to take it, what dose should we be taking? There's a good question. We don't know the answer to this. We do know that in high doses it can be toxic and carry significant side effects. We also know that there's probably a dose yet to be established beneath which rapamycin is ineffective. So we're looking for a sweet spot or a therapeutic window somewhere in the middle. To achieve this, we're going to need to monitor for side effects and blood levels of things like LDLs to ensure we're using a non-toxic dose. We also need to ensure that we don't knock out our immune function, which we'll also be able to measure with blood tests. As a point of interest, currently most transplant recipients are taking somewhere between 14 and 35 milligrams per week, depending on their tolerance, and most longevity patients, as seen in the study earlier, are taking 5 or 6 milligrams per week. And finally, should we be taking rapamycin? Well, that's a question for you and your medical professional based on your personal appetite for risk and or keenness to explore alternatives. And it's something we want to avoid starting too early so as to avoid impairing normal growth. However, it's also important to consider that a watch and wait approach is choosing not to take it for now, and that if it is effective in slowing the rate of age-related damage to our cells and bodies, then jumping on the train sooner rather than later will be worthwhile overall. That's all for now. Thanks for watching.